I'm Jennifer Lyerly, and Darryl, it's good to see you.
Yeah, good to see you as well. I'm Dr. Darryl Glover. Nice to see everyone out there in the world. Jen and I just wanted to update you guys on what's going on with COVID-19 and just the entire world, but also in the eye care world as well.
As you can tell, we're recording from home. I've got my kitchen in the background, and Darryl, you have a lovely background.
Thank you. I'm actually in my office right now. I'm away from the family downstairs. So it's like some me time. This is actually where all the magic takes place when we're recording podcasts and edits as well. So I need to have my little place to hang out, Jen. Is that okay? Is that cool?
Yeah, no, I'm like, oh gosh, I shouldn't just be sitting in my kitchen. But this is where I do a lot of stuff because the baby is taking a nap right now
Okay.
upstairs,
Cool.
and
Cool.
the furthest room away from the nursery is the kitchen. So I can have like my coffee in here and just be a little bit more talkative and not worry about like waking her up with any loud noises like your voice.
Yeah, I know. I'm a little loud. Everyone tells me in the exam room, they're like, Dr. Glover, I can hear you outside, man. You're breaking HIPAA. I'm like, my bad. I apologize.
Well, I one of the things that we want to do, because earlier in the week we had posted a lot of like, what are your offices doing? There was so much confusion, and there have been more clarity, I would say, given in the past couple of days, especially as the CDC made their announcement that we should not be doing routine eye care. Patients should be postponing those routine eye care appointments. But I feel like across the country, I'm still hearing some people kind of interpreting what routine eye care is in different ways. So this podcast or discussion is not to be what's right and what's wrong, but let's just kind of check in on what we're individually doing. So what are you doing right now with patient care?
Yeah, we've suspended patient care over at my eye doctor. I mean, we are in the office taking calls, I guess you could say telemedicine in a way,
Mhm.
which has been great because we've had people contact us asking questions. Of course, we're asking questions in regards to, some of the symptoms, if they've been traveling and all that stuff before we actually decide to bring them in the office. But we are abiding by, what the AOA and the CDC has stated. But when it comes to corporate optometry, I know that there has been a lot of players in the game that have actually temporarily shut down or have a pause right now in eye care. From my eye doctor, which shout out to them for doing a great job in regards to that. Warby Parker, National Vision, I think I saw iMart as well. So there's some folks out there, Vision Works, that have really stepped up to the plate and shut down business because that's important. As a team member, as an associate, as an employee, you want to work for a company that is all about you and not just all about that dollar sign. So I take my hat off to these large corporations in regards to them really shutting down patient care and doing the right thing. How's the world in private practice, Jen?
Yeah, so sometimes I think people might say, oh, with corporate, maybe it's easier for them to make this decision versus private practice. And our private practice, we've also made the decision to close. We are going to have someone answering phone calls, triaging via telemedicine as well. If there is, someone that calls in with a sty or a red eye, let's try to help without making them come into the office when those cases are possible, of course. Um,
Absolutely.
but not seeing any regular patient care hours. The office is closed. Our employees are actually, we're all kind of laid off at the moment. And that's another point
Oh
of
my.
discussion that I want to talk about, like the decision, if the office is closed, do you lay off? Do you furlough? There's legal pros and cons on each option. And I think the decision for each practice owner might be different. But I think it was very challenging for private practice doctors to make this call because we do want to do what's right for our patients,
Right.
but then we also care about our staff. And
Yeah.
what does that mean for your staff if the office is not open and they're not getting a paycheck? And that was a big concern for a lot of private practice doctors, is taking care of the people that they see every day and that they're employing. And unfortunately, it's been one of those almost like the moral trolley car experiments when you're driving the cart and do you swerve and hit this person or do you swerve and hit that person.
Right.
There
Right.
was no answer that didn't hurt somebody, whether it was financially, but at the end of the day, we had to decide not to hurt anyone, potentially physically, put them at risk of getting sick. So, and protect our communities as much as possible. And I think that, each practice situation might be different, but we've, as doctors, are supposed to do no harm, and we have to think about our community and any risk we're putting our patients in.
Yeah, Jen, I was, just going down my social media feed, and I'm friends with a lot of independent practice owners. And I just like almost shed a tear because I was seeing laid off 40 people, laid off six doctors, laid off whatever it may be. And, it's just a tough time. I mean, it's sad to see. One thing I am glad to see is a lot of people having faith, in regards to, the man up above. But just I'm passionate about eye care. I know you're
Mhm.
passionate about eye care. So for us to see our colleagues going through this tough time and us going through this tough time, it's just sad, man. It's sad. The one thing I can say that I benefit from this is it's allowed me to slow down a little bit, been able to get a little more time with the family, exercise more, changing some of my eating habits. So I'm just working on myself right now, which is great because with all that we have going on, Jen, whether it's defocus media, patient care, doing lectures, or just doing social media in general, we kind of put some things to the side, and this is a great time to really just unwind and just be with our loved ones.
Yeah, that's nice. I mean, it's so there's a part of me like, oh, you're exercising and you're eating well. Like every free moment I have, I'm just investigating like, what else can a baby play with? Because I just have to find a way to entertain my 10-month old all day long.
Well, Jen, you got to remember, I've been eating very well. My wife has been cooking like crazy, so my belly, it went from like here to like meow. So I got to get back into my hustle and bustle and work it out and get that bottle shape back because I'm no good to anyone if I'm not healthy. So that's the main reason why I've been looking at that more than anything.
You know what? Now that I'm thinking about it, you're wearing a striped shirt today, and the last time I saw you in a black white striped shirt, you were wearing these like really skinny, like
Oh man, don't even get me
tight
started
about
on
those
those
pants.
jeans. Jen, I still own those skinny jeans, believe it or
I
not.
thought you did.
Yeah, yeah. And last time I put them on, like, yeah, it was a little bit of a struggle. Struggle was real. So that's why, I said, you know what? I got this downtime. Let me take full advantage of it. This morning, I actually walked 2.7 miles.
That's great.
That's
Well,
impressive to me.
unfortunately, not to be, I'm like this, I'm like, they're closing the parks, Darryl. Like, that was my one solace for taking the baby to the park. So we're just going to be walking circles around our neighborhood like
Oh, yeah.
crazy people. It's
Absolutely,
going to be
absolutely.
fine.
Well, as you guys can tell, Jen and I, we can get off on a tangent and talk about a little bit of everything underneath the sun. But that's why we love hanging out with each other. Not only do we just do podcasts together, but we are in real life real friends. We actually have conversations and talk to each other every single day. Jen, I'm not in a private practice. I would love for you just to go a little more in detail about some of these terms that you mentioned as far as laid off and furloughs. Like, how does that work? Give some of our listeners, our followers, some advice in regards to what they should do. Because this week, a lot of folks are probably going to make that complete change to figure out what they're going to do moving forward.
Right. Well, I want to start with just some core things I think everyone should be doing right now.
Okay.
One, anybody that you owe money to, contact them to get your loans deferred. Whether it's small business loans at the bank, rent, paying off equipment, your contact lens bill with your distributor, like contact the lab. See whatever you can do to free up some cash right now and push this back because this is a special circumstance. And maybe you're not going to get every single payment that you owe deferred, but
Right.
anything that you can get to make cash flow better is going to help you. And I've heard a lot of really positive stories about companies working with private practice doctors during this hard time. So it's definitely
Right.
worth that phone call. The other thing is try to, one, help your patients, but two, also kind of boost things up just a little bit monetarily because you're going to be dry for a while by contacting anyone who might need contact lenses ordered. These are reports that you can easily run through your EHR potentially, but just sending out, like, oh, we saw a contact lens check 2 weeks ago. We hadn't heard back from you about which lens you preferred or if you want to place an order. So our office is going to be closed for the next foreseeable future. And we wanted to make sure you weren't without contact lenses during that time. Your
That's a
patients
great
need
tip.
this service anyway. So, and many distributors are waiving shipping costs right now, direct to patient, even if they don't order your supply of lenses. So take advantage of that. You can get your patients what they need without charging them any shipping, which is great. Another great thing that I've seen doctors doing is just sending out blanket emails to patient databases. Maybe they didn't just recently have a contact lens, check. Maybe they were patients that you saw 6 months ago, a year ago. Send out an email and say, hey, we don't want you to run out of any of the supplies that you need. We are happy to help. We have these great free shipping direct to patient where you don't have to come in. Just, still either fill out this form or respond to us via this email or a phone call saying how many lenses you need, and we're going to get you what you need to help see you through. And you'll be surprised at how many people reach out to you because they don't want to go to the store. They don't want to deal with, doing anything right now to get something that they need. And they definitely don't want to be without their contact lenses.
Right.
The other thing to look into if you are going to be like you and me offering telemedicine services is what kind of platform might you be using. Now, if you work with a larger group, those decisions are probably already made, but if you're in private practice, there are a couple of good platforms out there. One thing that Dr. Garlick has kind of told me about is this platform called DoxyMe, DOXY.me, and she's been utilizing that. It's free, which is great, and it meets
free is good, especially at this time.
When you're using a platform, you have to remember if you're going to be billing telemedicine exams through Medicare or through insurances, you have to have live video audio. Okay, it can't be through your phone, it can't be a text message, it can't be email, so you real time have to talk with the patient with a video feed. So just keep that in mind, you need a platform that can do that when you're evaluating platforms.
Okay.
All right, let's talk a little bit about furlough versus laying off, because I will be honest, as we've looked more into this, it's very confusing, and there are going to be things that I don't have answers to yet, but I'm going to give you some just general advice from what we've learned so far.
Okay.
Laying off is just like what it sounds. They are no longer your employees. These employees are eligible to file for unemployment, but for anybody who files for unemployment, there's always like a 1 week wait time in between the last day that you work and when unemployment benefits should start. Now, there's some conversations that maybe some of the general unemployment stuff they're going to waive. Maybe you won't have that 1 week cooling off period, but I would advise employees that that's what it's always been in the past. So there's a chance they might have that 1 week wait.
Gotcha.
For many employers that are laying off staff, they might, to make up for that, be saying, okay, I'm going to pay you your 1 more week of payment as a sign of good faith or generosity. Just something to consider. Legally, you don't have to do that. The other thing with laying off is you do have to pay out all unused PTO. So if your staff has PTO that they've accrued and they haven't taken it, you have to pay all that out when you lay off an employee. Furlough is not firing someone, but saying, you don't have any hours. When you furlough somebody, the rules of it is that there's an expected end date. Now, this is, again, a special time. We don't know how long the offices are going to be for this. So I think there might be some loose interpretations there, but typically there's a start date to a furlough and an end date to the furlough. And the person who's being furloughed knows that specific time period. And during that specific time period, they can file for unemployment as well. Even though technically they're still employed, they're not getting paid or working any hours, so they're still eligible for unemployment benefits. The other great thing about furlough is if you offer insurance benefits to your employees, they're still eligible to be on your insurance benefits. Versus if you lay someone off and you offer insurance, they no longer have any insurance benefits. So that's something that could really, if your staff is used to that and you take that away during this hard time, that could be a challenge.
It could be a big challenge.
Big challenge.
If it's like one of your, if someone's not making a, decent amount, especially if they're not an eye care professional and they have some type of systemic condition like diabetes, hypertension, they don't have the financial resources to buy that medication outright, and they don't have insurance. I mean, that's a nightmare. That's bad.
Something you really have to think about. Now, many private practices that don't have that many employees may not be offering health benefits already, so then that doesn't come onto the table. But
Gotcha.
Depending on what you offer as a package with your practice, that could shift your decision making one way or the other.
Right.
The reason why, because I think on paper, most of us would say furlough is the way to go, right? You keep your employees employed, they're still eligible for filing for unemployment. You don't have to pay out the unused PTO, but this is where sometimes the decision to lay off is outweighing that.
Okay.
There was bill that passed on March 18th, signed into law by President Trump already. It takes effect as of April 2nd. It's called the Families First Coronavirus Response Act. And if you're a small business that employs less than 500 employees, those employees are eligible for 2 weeks of additional FMLA leave. This is at their full pay. Okay,
Okay.
so 2 weeks where they're not at work, but they're getting paid their full salary. And this includes if they're sick, if they're taking care of someone who's sick with coronavirus, or if they have to take care of their children because their children have been out of school or out of daycare closures because of coronavirus. That applies to a lot of staff because schools across the country are closed, daycare across the country is closed. And if you've got a working mom, then suddenly they have to be at home to care for their children because you can't leave the child unattended. So they would be eligible for their full pay. And there's a few restrictions on this. It cannot exceed $200 a day or a $10,000 total over that 2-week time period, but that's still paying out for most people their full salaries for 2 weeks.
Yeah.
And then for an additional 10 weeks, they're eligible for pay of 2/3 of their regular salary. So we're talking about 12 weeks of pay for these employees that are affected with those 3 situations where they would not be coming into work.
That's a game changer.
For a private practice, that amount of cash flow can be devastating to punch the numbers and calculate. Now they're saying that if this amount of payout could potentially harm your business and you can prove it, that maybe you could file for an exemption. But a lot of doctors are getting legal advice that getting these exemptions would be extremely difficult to prove, and you might spend more money fighting it than just paying everything out.
Gotcha.
So, that's for some employers tipping the scale to say we're going to have to do layoffs instead because they might be on the hook for multiple employees 12 weeks of their pay.
Gotcha. Wow, man. Being a private practice owner or being a part of that team, I mean, this is tough, Jen.
It's one of those again where there's no great answer, and you don't want to leave your employees without their pay and without their benefits in this really hard time. But it can also sink a practice. Like there are practices who may not recover from this. And with that pay that we were talking about, the up to 10 weeks at 2/3 pay, these FMLA benefits, they're saying that you would get a tax credit on taxes next year to help reimburse that. But I don't think the private practice owners are worried about right now is long term. It's just upfront. They don't have the cash flow, they don't have the payroll to pay that money out without seeing patients to make up for it. So the tax credit next year isn't helping them in this situation.
So Jen, what about these 1099 employees?
Yeah, I mean that's
screwed.
one. It's extremely difficult. You're an independent contractor. You're not an employee. It's so difficult to know what's going on. And I think many of us are going to be in a situation we've never had before. I was just talking to a friend earlier. I myself in the situation. I'm going to be filing for unemployment for the first time ever in my life. And that is horrifying to me. That seems so strange, but that's the reality that we're all waking up to.
Yeah. Wow. Yeah. I don't know where this is going to go. I mean, you've given us a lot of great information. Of course, we're going to continue doing this weekly throughout this entire COVID-19 situation. In the meanwhile, there are some things that we could do, like we touched on earlier. You could definitely work out. You could definitely learn more. There's a lot of online CE courses that you can actually take full advantage of.
CE Wire 2020 is a great one.
Yeah, there you go. A lot of webinars, and then also podcasts. We encourage you guys to really, hit up the website, defocusmedia.com, and catch up on podcasts. I mean, it's a great way to learn, a great way to, learn more about your colleagues, the journeys that they've made through eye care. I mean, this is a time that we really have to keep it positive, and hearing some of these stories that we recorded in the past have been very positive and uplifting for our profession. So we really got to, just be positive about the entire situation. Something else that Jen and I wanted to touch on, came across a great article on CNN where basically they have an area where it states, "You asked, we're answering our top coronavirus questions." So I just wanted to touch briefly on a few of these. First question right at the top. This is something that I'm pretty sure a lot of us are doing. Is it safe to get takeout from restaurants? I mean, how many of you have ordered takeout?
Also, is it your civic duty to get takeout from a small business right now? I kind of personally think that maybe it is. So
Yeah. It's like we're supposed to stay indoors, but we still want to, get the takeout, even though someone will be out. I mean, I don't know. But yes, we need to support these small businesses because if we were open, people would be supporting us, I'm pretty
right.
sure. But the answer is yes. But you may want to wipe down the packaging and containers just in case. There's no evidence to suggest the coronavirus is transmitted through food, the CDC says. It's generally spread through respiratory droplets. So, yeah, like Jen said, let's support these local businesses. Just make sure you wipe down everything prior to, digging in and eating that great meal. But, we have to do our duty in regards to everything on that end. Another one, how long does coronavirus stay alive on surfaces? I think this is a question that we're all, interested in knowing more about. And it says up to 3 days, depending on the surface. According to a study funded by the U.S. National Institute of Health, the new coronavirus is viable up to 72 hours after being placed on stainless steel and plastic. So if you think plastic, I mean, that's definitely fast food stuff, takeout that you have to look at. It also states it was valuable for up to 4 hours after being placed on copper and up to 24 hours after being put on cardboard. So we have to keep this stuff in mind. Let's see, what else is another good question here? I saw one on here earlier about just pregnancy. We have some patients that are probably calling and they're pregnant, trying to find that one here. That way we could go over that. Is coronavirus especially harmful for pregnant, especially harmful for pregnant women? And long story short, there's not enough data yet, considering that this coronavirus just emerged in humans a few months ago. So, they're still trying to figure that out. What can I do if my loved one suspects they have coronavirus? Don't visit family members with suspected illnesses. This is something that we've seen online. I mean, from Trump to the governor in New York, they're saying like, stay away. Like I know my mother, she lives in my town. She is 60 plus. She has hypertension. She has rheumatoid arthritis. As much as I want to go see her and hug her and tell her how much I love her, it's one of those things that, I need to fall back and stay here because I'm not saying that I have the coronavirus, but, you just want to be, proactive and make sure that you stay away from those elderly people, which, brings another thing to mind, Jen. I know you've seen online a lot of these people are helping out the elderly. They're taking them food and things like that. And now that we see that, this virus can stay on some of these containers and stuff for a long amount of time, that's kind of scary to think about as well. Would you agree?
Yeah, I mean, hopefully everyone just knows wipe down the surfaces, right? Because I do think, I mean, many of these elderly people, is it more dangerous for them to go out to a grocery store where the surfaces have been touched than a loved one delivering them food? So
Yeah.
I think that is still a great thing to do. In our household, we've done the same thing. Like, my in-laws are in their 70s. We have not seen them in several weeks now just because of the risk. And to be honest, we're optometrists, our listeners are optometrists, right? Guys, we were seeing a lot of people. We were coming into contact with 20 plus people every single day in patient care. And as we all know from viruses, you do not express any symptoms for a long time.
Yeah.
With coronavirus, the peak when you would express any symptoms after exposure is somewhere between 8 and 12 days after your exposure. So, I mean, we just saw patients this past week, Thursday or Friday, is when many offices started making that decision. So we won't know if we were in contact with someone that potentially gave us the virus between 8 and 12 days from now. And we might all be feeling fine now, but we don't know what next week's going to be. So one of the other reasons why I think it was so important to close is, even as optometrists here, we're seeing so many people that we might be passing issues to. We might be passing in and bringing into our homes and infecting our family and loved ones. And I think when possible, if you can limit your contact with even your own personal loved ones that might be in those higher risk categories, like someone who's elderly, it's a good thing to do because you just don't know if you've got something that's contagious right now.
Yeah, I agree. And Jen, this is my personal theory. I personally feel like COVID-19 has been around. I don't know if you recall last year from like maybe August to October-ish, everybody was having all these respiratory infections. everyone was coughing. It lasted for like 2-3 weeks. It was like the flu, but it wasn't the, your typical flu that we get here. I mean, there was a lot of stuff that was going down where people were sick for a long amount of time. I'm not one of these conspiracy theorists or
I was
anything
about to
like
say, I was
that.
like, ugh,
But when you sit down
conversation's
and think
going
about it,
to.
but think about it, Jen. I mean, don't you recall last year, like everyone was sick at some point in time with some type of upper respiratory issue where it put them
Yeah,
on the
yeah. No, my boss last year had pneumonia for a while.
yeah,
So there was a lot of sickness going on last year too. I
yeah.
remember because I was pregnant. It was awful to have like a horrible racking cough and like your diaphragm into your lungs already.
Wow. Well,
My rib cage was in a bad place. Got better.
well, one other thing I want you guys to do is also really take full advantage of, again, some of the forums that are out there. ODs on Facebook is a great resource. I mean, I just did a lecture not too long down in Atlanta for SECO, and I was talking about some of the different forums. And when you go on that forum, you can really tell that us as optometrists, we're just a great group of people. I mean, people are putting out their business, they're expressing how they feel, they're telling people how they can improve certain things, whether it's, the tips that Jen gave earlier, or whether it's, things that you could do for fun, like I touched on. So make sure you utilize those forums. Make sure you reach out to your colleagues. Make sure they're doing well. Make sure you just, not shake hands and kiss babies, but do your social distancing. But make sure you show love to our colleagues out there as well, because right now everyone's going through a tough time. And it's very important for us as eye care professionals to continue to be leaders in our communities, but also within our profession as well.
That's right. I want to give just one last shout out to Dr. Garlick because on Friday, when we were making the decision, furlough versus layoff versus what should we do, I mean, so helpful just to have a friend in this profession that you can call up that has advice. So she's just one shiny example of someone who's out there in the community helping others make really difficult situations by giving their own personal story. And so everybody who's out there sharing what they've done, just know that it is helping others because everyone's faced with hard decisions right now. And what you found out, what you learned through your experience of making a hard decision can really help when someone's making their decision.
You got it. Well, you guys, thanks for hanging out with us again. We're going to continue this up weekly with any changes and updates. Remember, it's your favorite optometrist, Dr. Darryl Glover, the lovely opto nerd, Dr. Jennifer Lyerly. And if you guys have any questions, feel free to email us. But also, again, check out the catalog, Defocus Media, a lot of great content. And we look forward to updating you guys. Be safe, stay healthy, and we love you guys.